Dr. Chad Shafer here, talking about chemical pain and mechanical pain. So essentially, these types of pain are completely different, but are oftentimes, unfortunately, treated exactly the same. So I always like to use the example of a tube. So if you think of a tube and you've got cells flowing down this tube, okay? So it's just like a tube that has water or cells that are going through it. So the faster that these cells go from one point to another point, you think about pain and how you experience pain. If the cells go to the other end a little faster, that means you'll have less pain. So if you're looking at something like a medication, like a narcotic to help you with your symptoms or your pain or whatever you have going on, think of those cells inside that tube traveling faster and faster and faster. So you're having less and less and less low back pain, let's say. So that's great and all, but what if you take those medications away? That's going to directly affect how fast those cells are moving through this tube, and again, your pain level is going to be exactly the same. So let's look at what mechanical pain is. So mechanical pain is something that as a physical therapist I see all the time. So mechanical pain is something that I always describe as it changes throughout the day, it fluctuates with movements and postures, and it gets better and worse. So in that tube example, if you've got these cells flowing through the tube, mechanical pain is like if someone took a pen and squashed that tube down. Obviously that flow is going to be disrupted, and again, the faster those cells flow to the end of the tube, the less pain you're going to have. So if I take a pen, squash it down, because it's mechanical pain, those cells are not going to flow, and they're going to flow very slowly, if at all. So that means you're going to have more and more and more pain. So this is someone that has lower back pain. Those cells are flowing through. You take some medications, they're going to go faster and faster and faster, less pain. But you've got mechanical pain squishing down on you. So if you take that squishing down on you, say with a pen or whatever it is, making that flow increasing, and eventually the pen goes away, that means those cells can flow at a normal rate again and not have pain without the use of the medication. That's a great example of really why a lot of people now are not treating, at least a lot of physicians and practitioners are not treating back pain or neck pain with medications anymore. And patients need to know this as well. As in that example, if we look at the source and what's actually going on, you open up that tube, the cells flow faster, less pain, and looking at the actual solution to what you have going on.